So there was a time in this country where the daily update of COVID-19 cases in the country by NCDC was as low as 100, and some few numbers thereabout. Now, of course, earlier we said that the cases of COVID-19 in the country is, getting higher every day. We see the update from the NCDC, and whether you believe it or not, COVID-19 is here and we are experiencing the second wave in the country. And some are saying that it's actually getting closer to our homes. But how ready are we? Let's take this background report from Francis Obia, and after that, we talk more in the studio.
In the last few months, many countries in the world have begun to experience a second wave of coronavirus disease, with a sudden increase in the number of cases and deaths reported. Nigeria has also been recording increasing number of cases in the last few weeks across the states.
This started in 2019 in China, right? And that was during winter. Now it's another winter period all over the world. I mean, everywhere, almost everywhere. So it's just common sense that what happened, how it started, because there's no medication, there's no vaccine yet. I mean, it's just, they're just launching the vaccines and what have you. You should expect that, that same period that this whole thing started, which is winter, it's approaching again, and obviously is going to be higher than what we expected because people are not taking measures. People are, they think it's not real, but it is.
Notwithstanding the spike in the death toll, some Nigerians still remain adamant to the existence of COVID-19. Therefore, the need for aggressive social mobilization, both at the grassroots and urban areas, to ensure physical distancing and the use of face masks becomes highly inevitable.
That's the reason why a lot of people just feel it's okay to go to church. That's the reason why a lot of people feel, it's just a party I can attend, it's just a few hours. Have you taken responsibility yourself? No, you haven't. So obviously you expect, people to not do what is right because we have not individually taken responsibility.
COVID-19 is not a death sentence, so submit yourself for testing if need be. Take responsibility and stay at home, as many survivors have shared their stories to let people know that COVID-19 is real.
Nobody should ever be deceived that COVID-19 is a make-believe. It is real. I suffered it. I went through as a doctor. We meet a lot of patients. We meet a lot of people. We are the front line in these COVID issues. And so I think I contracted it from one of the patients unknowingly. And wearing mask actually does not really give you immunity against you can wear the mask and wear all sorts of things, you can still come down with it. So I came down with COVID-19. I was very sick. I was almost dead. I was in Popular Isolation Center, and I thank God for saving me, because if not for the intervention, if not for God's intervention, I would have been dead. But even though the doctors and nurses at the Popular Isolation Centers were wonderful. They were wonderful. I was on oxygen. I was on all the drugs. I was just being maintained on life for 9 days. I couldn't eat. My urine was like zobo mixed with watermelon. I was almost dead. In fact, I didn't know time. I didn't know date. I didn't know who was around me. Even though I was not conscious, I was not unconscious, but I was just there on oxygen. And suddenly one day, while I was in the bed, I just felt some movements in my abdomen and in my chest. At the time when they had told me my kidneys had failed, my liver, all sorts of things had failed in my system. I just felt those movements. That was when God touched me. And suddenly I became well. I walked out of my bed, went to the bathroom and packed plenty of urine. I used to make only 10 to 15 mils of urine in a day. But that day I passed urine more than 200 or 300 mils at that time. And there I shouted, "Yay, I'm healed." So COVID-19 is real.
Personally, I've had my father who, sometime last year, I just called to say, "How are you doing?" And he said, "Someone is in the house. They're taking me to a center, and that was a breaking point for us. So it was actually a bad experience for us. So yes, I know. For me, I believe that, there's something called COVID and it exists, and we have to pay attention to our health.
Globally, the number of coronavirus cases reported has crossed 90 million, while over 1.9 million deaths have been recorded as a result of the pandemic. But with the non-adherence to the protocols by some Nigerians, are citizens prepared for another lockdown?
To be honest with you, I don't think that another lockdown is possible. The reason is there's so much hunger in the land. So when you say lockdown, what do you want to do with them? I mean, they are your citizens. Have you made provision for them? Do you just want to lock down because you feel, is necessary, or you have made all the provisions for them before the lockdown? I don't think it's really wise. I feel that we should just create more awareness, and then I think the government should do one major thing. People should pay fine. You don't wear your face mask. You pay for it, even if it is 1,000 naira. When they charge you 1,000 today, you pay. Tomorrow you pay. Next tomorrow, you wear.
Health, they say, is wealth. So take care of your health and protect others by obeying the protocols. Therefore, Weekend Deal today is tagged COVID-19 second wave coming closer home. How prepared are we?
Right now, let's welcome into our studio Dr. Muhammad Kau, is the Acting Secretary, FCTA, Health and Human Services Secretariat. You are welcome to our studios.
Thank you. Good morning, viewers.
I know you've shared your experience with COVID, a lot of time, but, for emphasis today, probably I might ask you about your experience at some point in the course of this interview. But second wave of COVID-19 is here with us. We've been warned about it, and despite all the warnings, we're still experiencing it. The idea is, if you are warned about something, you are able to prepare better for it. But what went wrong for this country?
Yeah, thank you. Good morning. Thank you, viewers. It is sad that we got into the second wave, which we tried as much as possible to prevent. But if you look at the virus, we are not the only people. Mm-hmm. The second wave had gone across the world, Europe, America, and all other places. Maybe the only places that are a bit safe are maybe eastern part of the world, maybe China and some other places. So if you have second wave in Nigeria, it's not surprising, considering the fact that till now, a lot of us don't believe that even the virus or COVID-19 exists.
But what is that really?
Which is really, really disturbing. Now, if people don't believe, how can they take precautions? As we said, I was infected with my family. So many people got infected, people died. Even with that, people don't believe. So what else do you think can be done? So I think the most important thing is to continue to emphasize to our dear countrymen that this COVID-19 is real, it's ravaging. It's sad if somebody has to wait to see people dying on the street before we believe. That will be too late. Maybe that person will not even witness it because he may be one of the casualties. So nobody will wish that, and nobody will want that to happen. Now, coming back to your question, why we came back is because we completely ignored the preventive measures that have been in place during the first wave of the virus to large extent, we obeyed. We closed our borders, we closed the country. Now, so many people, I mean, all the super spreaders have been cancelled, events have been stopped, large gatherings in the mosques, in the churches, weddings, all have been stopped before now. But immediately we started reopening the country, those things came back in full force. And ignoring the simple non-pharmaceutical means and ways of prevention. That is the washing of hands with water and soap or hand sanitizer, the wearing of face mask, the social and physical distancing, avoiding going into large gatherings, you know. So people just decision all these things and started partying around. And unfortunately, the virus has been around locally, and also a lot of people have been coming back from the West, from the Americans, and some came back with the virus.
We have more cases.
So we now have more cases, and you can see what is happening in Lagos. They are averaging 600 to 700. The country is averaging 1,500, 1,600 per day. FCT yesterday we had over 200. So really, we all have to come back to our senses. Take personal responsibility, because I always insist that whatever government does, if the citizens don't participate, don't take personal responsibility, it's very difficult. You can't go on the street asking everybody because the person refuses to wear a mask. Why are you going to keep them?
Now talking about, wearing of masks, of course, some people are saying that maybe the government should begin to enforce it on the citizens, because some people are citing, examples of what is obtainable. In South Africa, we understand about 20,000 people have been arrested in conjunction with, one form of bridges or the other, and about 7,000 of them were arrested just because they did not wear their face mask. Are you proposing a similar, scenario in the country just to emphasize the seriousness of this pandemic?
Thank you very much. Each state of the federation has its own enforcement arm. In FCT here, we have enforcement team chaired by the Commissioner of Police, Bala Chiroma, and coordinated by your colleague, Mr. Atao Cairo. They have been arresting people. Minister has set up mobile courts. They have been trying people, sanctioning people. People have been fined, and people have been paying fines. But how far can it go? So the most important thing, in addition to whatever you need to do in terms of enforcement, is for the citizens themselves to understand that there's a problem and they can get infected, they can die. So their lives are in danger. So if you get that, you know you have a problem. Now, if you travel to Kaduna on the road, you are going to be kidnapped. People stop traveling by road. They're entering, if you go to the train station, it's always full. Because they believe that when you are going there, you are likely going to be kidnapped. So you take personal responsibility. Are you getting me? Even if you want to travel by road, you don't stop on the road. You don't do this. So you take precautions by yourself. But if you don't believe that there's a problem, how many policemen can government bring out to stop the issue of insecurity and start arresting people not wearing masks? It's not going to work. Yeah, we continue to attempt. Like in FCT, we said every mall, you must put hand sanitizer at the gate, you must not allow this, you must not do this. We hold the owner of the mall personally responsible if you go for monitoring and you find that people don't. How are you getting me? So they are doing all these things. But when the larger part of the society don't believe in the thing, so you are fighting a large number of people. So it's a problem. So what we need to do is to continue insisting and informing people that this thing is real. We've been taking media houses to the treatment centers to talk to people on oxygen. Not 1, not 10, not 15, not 20.
Now when you talk about oxygen, I know that in Lagos and sometimes in Abuja, I don't know what the situation is like now, that it was a major issue in this, isolation centers, so if you like, the healthcare centers, where we don't have enough oxygen to, support people who are in critical conditions.
Yeah, thank you. This is a respiratory disease ailment. It affects the respiratory system largely, and so, especially in this second wave, the need for oxygen has increased based on what our experiences are. Normally in hospitals, oxygen is used for other patients, in the theater, in the emergency wards, and all those things. So most of the hospitals have their oxygen producing plants. Say for instance, if National Hospital produces 80 cylinders per day or 100 cylinders per day, and their consumption is about maybe 60. Now with COVID-19, the demand must have increased to maybe 150. So it's an issue of demand and supply.
Because why some people actually, worry is the fact that if you go to Nigerian universities whereby you have like over 500 students in a lecture theater, if you go to public school, secondary school, you see like over 100 students in a class that is not that big. Some actually, sit on the floor. Now, that congestion, we don't really know how the schools are going to manage, and how they will, be at par with, following all the precautionary measures, the non-pharmaceutical injections, like, of course, you cannot talk about social distancing in situations like that.
I agree with you. It's going to be a big challenge. It's going to be a huge challenge. So the institutions, the authorities of those schools will definitely have to think out of the box to see that a disaster is averted while the schools are resuming. Thankfully, the resumption is not that everybody must resume tomorrow. Okay. I mean, that the directive is that schools can resume from 18. So some say they will resume 25th, some are resuming February. So before you resume, there are things that you have to. For instance, let me tell you what is happening in FCT. Before the school started resuming, even during the first wave, a decision was taken that you divide the classes into half. Half will come in the morning, and so all the classes will be spread to those sets that are coming. For instance, in the junior secondary school, maybe JS1 and JS2 will come in the morning, and so the other JS2 will come in the afternoon. So all the classes are spread across this, so you reduce the number of pupils or students in each class. Right. So these are some of the things, but we are really in a challenging situation. And I think everybody must, instead of complaining, blaming, everybody must bring ideas as to what can be done. Because these are health issues, but they are also social issues. It's not only the doctor or the health personnel that is supposed to tell you how to run a school.
Mind you, some people really don't believe that it's COVID-19 in the country, sadly. So now, I know the new variant of COVID-19 has been found in some countries. You talk about England, Brazil, South Africa, and I know, if I get it right, even Kenya reported a case a couple of days back. What is the situation in Nigeria? Do we have a case like that in the country?
Yeah, interesting. Yesterday I had a live program on Radio Nigeria with a virologist and epidemiologist too. He gave an information that one of the private universities have isolated a new variant in this country. So I believe it's going to be published probably very soon. I have not seen it from NCDC. Right. Neither did I see it from Federal Ministry of Health. So for now, I'm giving this information based on what he gave. He said on air yesterday. It's not likely you're going to escape from variants because the viruses mutate. When a virus enters a host, in this case human being, and is exposed to certain things, it also tries to adapt or tries to beat the system by changing some of its characteristics. How we get it? So that's what we call the variants. So they continue to change as we go.
Dr. Kawo, I know, experts in this field are still trying to understand the true behavior of this, virus. And just because of this mutation stuff you're talking about, some people are saying that even the new vaccines, like being, distributed around, might actually not take care of the new variant, given the fact that it was not. The case study is...
Interestingly, the same virologist answered this question yesterday, so I will quote him.
All right.
That when manufacturing this vaccine, they have a length, a wide gap when producing it, so that even if it mutates, you still have a chance of... Like if you are trying to solve a problem, if something is supposed to take 1 meter, you say because of some factors that may come, let's put these things to 2 meters at worst. When this thing happens, you are able to cover everything. So that's what the vaccine manufacturers usually put into consideration. There are variants or parameters they use in case of the mutation, so that they're able to cover a lot of mutants that may emerge.
All right, so we have a question here, an interesting one from Anino Abram from Calabar. He says it's all about this new vaccine and those conspiracy theories around it. That what does it mean to say that the vaccine changes person's DNA?
I'm a virologist. I will also give the answer the virologist gave. He answered the same question. And I'm happy that I was with him yesterday. So he answered so many questions concerning this. He said it's not true. The vaccines do not alter anyone's DNA or RNA, whatever you call it. So they are just conspiracy theories. He said, and I also say, if the vaccines comes to Nigeria today, I will take it and I will ask my family to take it. People are producing these vaccines to protect the humanity. And it's not only Nigerians or blacks. There are lots of conspiracy theories, but they are all, because of the social media, very easy. Somebody just sits down to construct a video and send to the society. You don't verify who that person is. You don't know his motives.
You just hold on to it, and you start sharing it, and the information keeps going. But as we wrap up,
and before I land, look, we are a country of responsible people. There are agencies of government that are responsible for checking, testing, and approving any product that
comes into the country.
That comes into the country. NAFTA is one of them. There are research institutes that they have to do their checks. They have to give they have to certify before even government take decision to start implementing.
Well, it's like some say, this is not time to listen to rumor. This is time to follow science. But as we wrap up quickly, speak to Nigerians about the reality of COVID-19. Really,
COVID-19 is real. COVID-19 is ravaging. You should, if you get into any of our treatment centers, you will attach faces to all these figures. You will attach faces to all these deaths. People are dying every day. Every day, people are dying. There is hardly any family that I know around Abuja that did not lose 1 or 2 people. And unfortunately for death, if you lose 1 person, you have lost 100%. There is no 0.5% or 10% of an individual. If a child loses a father, she has lost a father 100%. So people are getting infected. We don't sleep. You are always cold. This place is getting filled up, so open this place. Get more health workers to report because we are getting overwhelmed. So these things are real, and they are going, and government is doing its best to protect the society. So the citizens should also help themselves and help government.
This is a time to be, responsible as individuals, because our actions will go a long way in easing the burden on the frontline workers, because, of course, like you said, it's not been easy.
Definitely.
Thank you very much for sharing your time with us this morning. And we have been speaking with Dr. Muhammad Kau, is the Acting Secretary, FCTA Health and Human Services Secretariat. Right now, we go on a break, and after that, we still have more for you, still on COVID-19 second wave in the country. So stay with us. Thank you for staying with us. Yes, this awareness, we must continue to engage it, because a lot of Nigerians still don't believe that COVID-19 is real. People are contracting COVID-19, people are dying from it, and of course, you just need to look around and you see the reality. So I really don't know why some people up to this moment are finding it difficult to believe that this virus is real. But we will continue to share this message. We'll continue to drive this message home. And this next feature that you're about to see is actually in that direction, where individuals, talk to Nigerians about the reality of COVID-19. Let's see this.
Let's start by saying COVID-19 is real. I personally know people, friends that I have grown up with, that have one just got discharged, another one died, and right now I just received news of somebody that I know has also been infected.
I'm also a victim of this pandemic because I contracted it and I was very ill. I remember very well, my temperature was 39.5 degrees for a very long time. I was shivering, I was cold, even where there are no air conditioners. And you lose appetite, you'll be weak, and you'll be seeing death, actually. You'll be imagining that, look, well, probably that's the way it would go.
And, several government officials that have gotten infected, some have died. Even among us ministers, some of them, and they have tweeted, it's not a crime to get COVID, because you do not ask to get COVID, but if you don't do the right thing to protect yourself, then it's a crime against yourself and against other people that you might infect.
And I know members of a family in Kaduna, 8 of them, went for a wedding, sitting on the same table. All of them died from COVID.
This is not the time is COVID positive, no. Unfortunately, people need to be cured, tested, and make sure that they are totally cured. Conspiracy theory about vaccines will do this, vaccines will do that. No, science is what we are talking about. And these vaccines have been subjected to scientific evidence, scientific analysis. They have gone through thorough analysis and testing. So please believe in science, not just in some kind of theory that somebody doesn't know anything. He'll just sit down and cook up or hear it from someone and then add his and now start spreading.
Yes, there is COVID. Are people contracting it every day? Yes. Are people dying? Yes. And look, when people in this country tell you they don't believe in it, we don't do testing. The testings are so low compared to the population of this country.
So let's make sure we get the COVID out of our country, out of the world, and it will start with you. Take personal responsibility. First of yourself. I know you have responsibility to others. Family members, friends, colleagues at work, and the people in the whole country, and by extension, the whole world. Be part of the solution, not part of the problem.
My brothers and sisters in this country, Nigeria, COVID is real. And I, Farouk Adamu Aliyu, I'm a victim of COVID. I came out of it. And it is real, so that let's take it serious and ensure that we wash our hands, we use masks, social distancing, so that we reduce the transmission of COVID. Thank you.
Safety first. It doesn't matter if you believe in it or not. It's a responsibility that we all must take. Protect yourself, protect others around you. Now, to continue with this conversation, we have joined us in the studio Mr. David Akoji is the Special Assistant to the Director General of National Orientation Agency. You are welcome to our studios.
Thank you very much. Good morning, viewers.
All right. So, Mr. Akoji, you know all that has been happening in the country. Some say COVID is real, some say COVID, a large percentage of the Nigerian population still don't believe that this COVID-19 is real. And I know you are working in an agency that is, saddled with responsibility of creating awareness about some of these things. Now, why do you think up until this moment, despite record number of cases, despite record number of deaths in the country, some people still find it difficult to come to terms with the fact that COVID-19 is real in the country?
I think you would appreciate the challenge that we're having in terms of disbelief. If you put it within a global context, it'll amaze you. But even in the US, in Brazil, in the UK, some of these countries that you would consider very advanced in terms of knowledge, and in terms of familiarity with the facts of science and medicine, they experience disbelief at even very high levels. The outgoing president of the United States, Donald Trump, did not believe in it.
China virus.
Ab initio. The Prime Minister of the UK, Boris, didn't believe it until he caught it. The Brazilian president also did not believe. So the challenge of disbelief is not peculiar to Nigeria.
Would you say that with all these names you have mentioned now, are politicians part of this problem?
I think that at the beginning of the outbreak of this pandemic, the narratives we were getting, not only from politicians, from religious leaders, tended to drive this situation of disbelief. We had significant religious leaders in this country who were saying that there's nothing like COVID, and who were influencing their members to disregard the prevention protocols, who were also driving this narrative, of disbelief, drawing examples from other parts of the world, to influence their followers into thinking that COVID does not exist. So, yes, there are some politicians, some highly placed even, who are claiming that the disease is not what it is. But you and I know that that is not true. We see the devastation that COVID-19 is causing across the globe. We see the death toll, in various countries across the world. If you contextualize it within the African continent, you see what's happening in countries like South Africa, countries like Niger, our neighbors here, Benin Republic, Morocco, Egypt, all of these countries that are experiencing various strains, of in the second wave, of this. And you see the general death toll, across Africa. And you see videos and pictures coming from the UK and the US, how their health systems are completely overwhelmed, by the devastating effects of this pandemic. So I think the pandemic stares us in the face, and that it is foolhardy for anyone to continue to disbelieve the existence of the virus.
We also know that transportation is very key in the spread of COVID-19 in the country, because virus doesn't move. People move the virus, you understand? And of course, despite the fact that people have often been advised to stay, if it's not necessary, they don't need to travel and all of that. Some people still deem it fit to engage, that and of course, Onobu actually put together something to do with transport sector vis-a-vis the spread of COVID-19 in the country. So let's say this.
Nigerians move around for different reasons, to visit family and friends, work, school, shopping, and so on. They use cars, buses, motorbikes, planes, canoes, ferries, trains, lorries, and others. However, issues of insecurity concerns such as banditry, kidnapping, faulty vehicles, and bad roads have hindered movements across the country. But in recent times, a major factor militating road traveling is the dreaded coronavirus. So, people cannot travel as freely and frequently as they would love to. During the lockdown in Nigeria, restrictions were initially placed on mobility. The roads were empty except for essential workers such as medical practitioners, the police, road safety officials, just to mention a few, who made sure they stayed empty. Movement on the streets depended on the curfew as well. Flights and railway services were suspended while seaports were put on high alert.
The Presidential Task Force on COVID-19 came out with a protocol that, number one, they should not load maximally, that is to the maximum level. It has to be 50%, which is physical distancing. That is, if you are loading 18 passengers before, you are expected to load between 9 and probably 10, or at worst 12.
However, it was observed that most commercial drivers in major cities across the country dropped their guard in observance of the COVID-19 protocols in terms of social distancing and wearing of face masks. They went against the prescribed number of passengers. In some instances, they carried 2 passengers in front and 4 at the back, while some passengers failed to wear face masks, including the driver. This has invariably led to all kinds of conspiracy theories about the coronavirus pandemic.
Some commercial drivers and fleet operators resorted to driving in the night so as to avoid the road safety people, because they know they don't patrol in the night. And some passengers fell for it.
The only way we can collectively combat COVID-19 is to accept that it is real and it can harm people. Due to non-compliance with the specified WHO preventive measures, the number of COVID-19 cases keep rising.
As a driver, you must know that COVID-19 is real. Passenger must know that COVID-19 is real. We must all obey the protocols. The government is serious about it, and people are dying.
Whatever mode of public transportation we find ourselves in, we should follow the guidelines set out by the Presidential Task Force. Observe social distance. Wash your hands with soap and running water, and wear your face masks.
Okay, there you have it, an interesting one there. And of course, you can be a part of this conversation via the numbers displayed on the screen right now. And we still have Mr. Akuji here with us in the studio. He's the special assistant to the DG of NOA, that is National Orientation Agency. Now, I know your agency is tasked with, information dissemination, and a lot of people believe that when we at the beginning of this COVID-19 and even now, you are supposed to be in the forefront of this information dissemination, awareness, making sure that this message of COVID-19 is, everywhere. But some have actually criticized your agency for not doing much in that regard.
I have answered this question on several platforms,
okay.
Several television and radio programs. I think to be able to understand the national response to the challenge of COVID-19, we need to cast our mind back to the beginning, around February the 28th, when the index case was established. A presidential task force was set up. The perception and the thinking at that time was that COVID-19 is a medical challenge, and that its risk communication also required some level of medical expertise. Now, risk communication and community engagement is the place where National Orientation Agency comes in. in this wise, the response strategy put the health promotion officers of the Federal Ministry of Health in the forefront, in that position that you thought NOA ought to have been. Reason being, there was thinking that you needed to know how to protect yourself even while you are sensitizing people, concerning the challenge of COVID-19. Now, all that while when all of this criticism was coming, this was the structure that was on ground. And NOA was not part of that structure at the beginning, because of this thinking that I just explained to you. But
is NOA part of the structure now?
Yes.
Since when?
There's been huge public outcry. So NOA became part of the structure at the risk communication and community engagement pillar level.
Since when?
Since last year, I think August or thereabouts.
All right.
Or July, August, September or thereabouts. And since that time, we have conducted robust sensitization in the 774 local governments. In FCT here, we have carried out repeated sensitization efforts. We have collaborated with the FCT authorities, National Orientation Agency, and I was part of that collaboration to design risk communication and community engagement. We have been to all the area councils in FCT. The traditional rulers in all these area councils will attest to what I'm telling you. The local government chairman will also attest to this that I'm telling you. Now, there's a national response structure to COVID-19. That national response structure establishes state task forces on COVID-19 that are structured mirroring the federal PTF, with various pillars responding to various aspects of the challenge that the pandemic has brought about. Now, in the risk communication component of that response structure, it's not only NOA that you have there. You have NCDC, you have National Primary Health Care Development Agencies, you have civil society organizations, you have Ministry of Information, we also have NTA, FRCN, and such others. But you see, attention is usually paid to the National Orientation Agency, largely because people know that we are very effective when we are triggered.
But surprisingly, you have not been effective when it comes to COVID-19.
Absolutely not. You are wrong, sir. I just listed people that you can confer with.
Well, don't you think that maybe you say you've been asked this question over and over again? Don't you think that this thing is actually obvious that, you get asked this question because you have, media organizations in every part of the country. And if you say your work is at the rural areas mostly, you talk about the FCT. What about the state? You have offices scattered in almost every part of the country.
I'm particularly amazed. One place where this impression, of the NOA is not there is NTA. Because together with NTA, we have done very intensive communication work. As I speak with you, even today, our jingles on COVID-19 are still running on NTA every day.
But what about people who don't have access to radio, television?
That's why we go to the markets all over the states and the local governments. That's why we go to the churches, the mosques,
now,
motor parks.
As you engage all of this, what has been your major challenge, really?
Well, our major challenge is that we have discovered that the attitude of Nigerians is not driven by a lack of sensitization, because there has been in-depth sensitization. Not just by NOA, as I told you. NTA also has its own jingles that is running on COVID-19. And NTA,
a lot of them we do have.
Absolutely. And you also run a lot of hours too that we see every day.
We're running
on
one
NTA
right now.
That's the point I'm making. And this is being seen all over the states and the local governments across the country. NCDC has been doing robust risk communication, including training of trainers who ought to go out and train others to be able to communicate the risk, of COVID-19. So our challenge is really not the lack of knowledge. Our challenge is the disbelief, which has continued to persist.
But why do you think that, despite, of course, you cited, examples with other countries as well, it's not just Nigeria, why do you think this disbelief persists, despite the fact that we are recording number of cases, people are dying from this COVID-19? Do you think it's a lack of trust somewhere?
Well, I would say that disbelief is human nature.
Okay.
You understand? It's human nature. If you take the Christian belief, for instance, amongst the 12 disciples, there were those who did not believe. Thomas, proverbially called the doubting Thomas, was the one who said, let me put my finger in the hole where the nail passed through to be able to determine that truly you are the one that has resurrected and has come back as you promised, you would. Even among the 12 who saw all the miracles, that Jesus did, who were with him day and night, whom he told that these things will happen the way they began to see it happen, a lot of them did not believe. When Mary came in there and said she had gone to the tomb, so disbelief is human nature. And like I told you, it's not peculiar to us in this country. What we need to do is rev up our strategies to put the problem right in the faces of the people. Most of the places we have gone to where people speak of their disbelief, they say, I have not seen somebody who has it. None of my relations has died, of it. So it doesn't matter to them that other people's relations are dying of this disease, as truly is the case. I know of quite a number of people who have died. And in that clip you just showed, I saw a gentleman there who was also talking about people known to him who have died. The disease is as real in Nigeria as it is in other countries of the world that you see on television where people are dying. It's overwhelming health systems in various countries of the world.
Yeah, well, of course, we will continue to drive home this message because it's really, really baffling, really worrying that some Nigerians still do not believe that COVID-19 is real. But let's take our next report from Rivers State. We want to look at the situation report and to see how people are complying or not complying with COVID-19 protocols.
The COVID-19 pandemic has exerted an enormous and shocking impact on the entire world. The economic and social disruption caused by the coronavirus has been devastating and is considered as the most crucial global health calamity of the century, with the cases of COVID-19 still surging in different parts of the country. The level of compliance to protocol still differs across the states. In Rivers State, the level of compliance with preventive measures have been received with mixed feelings, although the government, institutions, the private sector, and stakeholders are not relenting in their efforts to curb the spread of the coronavirus.
You go to marketplaces, you go to eateries and the likes, people where people always want to turn up to get to have their daily bread. You see a lot of persons flouting this COVID. People don't wear face masks anymore. Why? Because I feel they're actually fed up with the whole thing. Some people are still doubting if there's actually COVID-19. Some people are asking, okay, where's the person that's actually contracted COVID-19? For sure, COVID-19 is actually real.
On the issue of COVID-19 in Rivers State, it depends on individuals. Some are serious about it, and why some are not serious about it. Also, the compliance in Rivers State, not too interesting. Some fix masks and why some don't. They feel coronavirus is not real, or it's not in existence.
The children wash their hands when they come to school. They sanitize their hands. And then, yes, the face mask is not too effective because they are children. So they can't stand the heat of having a face mask on them for a very long time. They come to schools with face masks, but in no distance time, they take it off, which we all understand the nature of children.
A lot of people are still basking in the bliss of ignorance. So at public places, a lot of people at the markets basically just doing their normal things, being in crowded places without wearing any face masks, shaking hands with other people. The level of compliance with COVID-19 guidelines in general society has been poor. In the hospital, for example, because it's because it's mandated or stipulated that before you can be seen by a doctor or by a nurse, you should wear a face mask. So in that kind of setting, people tend to wear theirs, but then once they leave the environment, it just reverts to status quo.
For some residents, compliance to the COVID-19 preventive measures is like a double-edged sword cutting across their daily lives. With the second wave of the pandemic threatening, the government and the health sector are coming up with measures and efforts to simultaneously interrupt the spread of the virus, which include possibly a second lockdown.
We don't need second lockdown. Majority of the citizens survive from daily income. When you lock them in now, okay, we are complaining about the banditry, stealing, armed robbery, or hunger is the number one thing that will push a man to the street to go and steal. You have families, you don't have means of going out to work to feed them.
Presently, we are having a very big hit on the effects of the lockdown. Pupils are very, very backward in academics. So looking at the second lockdown will not give us any headway at all.
Considering what happened during the lockdown of earlier in the year, I cannot say for certain that it was as effective as it should have been, and on the contrary, there are a lot of economic setbacks that it caused for the people. So at this time, no, I don't think so. The economy is not ready, the people are not ready, society is not ready for another lockdown in Nigeria.
As the pandemic continues to evolve around the world, there is need for the country to continually adopt best practices. Measures taken should strike a balance between sustaining the economy and minimizing or limiting the spread of the virus.
Well, most certainly strike that balance, but it's our responsibility to ensuring that we do not experience another lockdown in the country. Thank you very much for, sparing your time with us here in the studio. And yes, we've been chatting with Mr. David Akoji. He's the special assistant to the DGNOA. Right now, yes, Mr. Akoji did mention something about testing. Yes, that's one key area that Nigerians believe that we should do. We should be more proactive in engaging, more testing in the country. We should have more testing being conducted, because some people are actually saying that we have not even tested 0.5% of this population. So are we doing enough testing? That is the question. NTA Maiduguri seek to answer.
If you know the hospital that you should go and test the corona, it's better for you to go and know your status, because by knowing your status, you should prevent yourself and you should prevent your family. Without knowing your status, you cannot prevent yourself. You separate the disease without knowing that you have the disease.
COVID-19 response in Nigeria has propelled a raft of innovations. This has helped health experts manage the virus, ranging from contact tracing, clinical care to laboratory and testing materials.
In Borno State here, we have a lot of testing kits. We have it at the Center for the Control of Infectious Diseases, and also the University of Maiduguri Teaching Hospital also. They have that laboratory that conducts those tests. And it will not cost you anything. So why don't you just go and get tested if you feel that you are suspecting something near or similar to the symptoms that are being rolled out in terms of this COVID-19.
We started testing in April 18 precisely, 2020. So far we've tested 15,655 samples, and out of these 962 are positive. Anyone that wants to be tested should go to the isolation center or where the collection center, and the samples will be collected.
We have functional teams to collect samples in the field, and we can confidently and comfortably say that we do not have major challenges when it comes to sample collection, transportation, and testing. This, however, done in collaboration with support from partners. So far, this is where we are with testing. And I can comfortably also tell you that the system, either through community active case finding or in the hospitals when there are suspected cases, they are immediately linked to a particular sample collection team.
COVID-19 testing is very important. This helps to determine if people are infected, regardless of whether they have the symptoms or not. In line with this, the Borno State government, in collaboration with Nigerian Center for Disease Control, NCDC, development partners and other stakeholders have provided health facilities and testing center in the state to help cope the spread of the virus.
COVID complication comes when maybe difficulty in breathing. And there are so many other things that can give difficulty in breathing too. So to really say that this is COVID, caused by COVID, we have to do the test for differential diagnosis.
Lab equipment has improved. Capacity and supply have expanded and results are being returned in good time. Therefore, for you to get tested, contact healthcare providers.
Being infected with COVID-19 does not mean that you have signed your death sentence. So therefore, we should try as much as possible to protect ourselves and to protect others. We should engage in voluntary testing.
Healthy people should come, and anyone that has symptoms suggestive, especially respiratory, anything to do with respiratory, should come so that we single it out and say, oh, this respiratory infection or this person symptoms this person is having, oh, it's not COVID, oh, it's influenza, or it's something else. So it's better.
Testing does not eliminate the virus, but when combined with precautions like wearing of masks, hand washing and social distancing can reduce the spread of the virus. Nigerians, let's take responsibility and save our lives.
Well, we'll continue to, drive home the message. Let's take responsibility. And of course, this is where, we wrap up the show, and we continue to remind you that COVID-19 is real. Let us, take those non-pharmaceutical injections as serious in order to hold the transmission of the virus. We'll see you next weekend. Bye for now.